Hello! Thank you for taking interest in our survey. This is a short video to introduce you to the survey. The name of this survey is the International Survey on Health Literacy and Healthcare Organization. The purpose of this survey is to assess hospitals on their health literacy and to provide a way to have more awareness for health literacy. There are 10 attributes, and these 10 attributes are tested on the survey. At the end of the survey, there are also additional questions. The attributes are leadership, hospital management, inclusion of the served, healthcare literacy skills range, communication standards, provide access, media variety, high risk, costs, and workforce. The attributes each have a general question, which is bolded, and under each bolded general question, there are 3 to 5 sub-items that test the 10 attributes. For each attribute, there is a bolded general question. For leadership, the bolded general question is, to what extent is the management at your hospital explicitly dedicated to the subject of health literacy in the following areas? For hospital management, it is, to what extent is the topic of health literacy considered in quality management measures at your hospital in the following areas? For the inclusion of the served, it is, to what extent is health information at your hospital developed by involving patients in the following areas? For health literacy skills range, it is, to what extent is individualized health information used at your hospital in the following areas? For communication standards, it is, to what extent are there communication standards at your hospital which ensure that patients truly understand the necessary information in the following areas? For provide access, it is, to what extent are efforts made for patients to access services provided by your hospital in the following areas? For media variety, it is, to what extent is information made available to different patients via different media at your hospital? For high risk, it is, to what extent is it ensured that the patients have truly understood everything, particularly in critical situations in the following areas at your hospital? For cost, it is, to what extent do you communicate openly and comprehensively to your patients in advance about the costs which they themselves have to pay for services in the following areas? For workforce/human resources, it is, to what extent are employees at your hospital trained on the topic of health literacy in the following aspects? Each rating is based from 1 being absolutely not to 7 to a very large extent. Please think thoroughly for each question and what the hospital situation is for each question. Under each attribute, the overall sub-item does not need to be an average of the sub-items above it. The overall sub-item is a term meant to describe the general situation of the hospital, not an accumulation of all the stated sub-items above it. Also, make sure to answer the additional questions below the survey. If there are further questions, do not hesitate to email or call AHLA about the survey. We are very willing to provide assistance in any way. Thank you for your support in health literacy.